Why does the spine imaging and diagnosis become a clinical problem that causes headaches for doctors and patients? As early as 1994, bone experts including SLIOSIS Research Society SRS hoped to invent a new three-dimensional diagnosis and data analysis solution to obtain information of the spine palate position and scoliosis, as well as the angle of the vertebral rotation, after meeting the requirements of regular examinations. At present, the doctored image stitching method is mainly used for full spine imaging. In traditional X-ray shooting method, there is a margin distortion effect, which causes tolerance in image during the image acquisition stage. The correction between stitching images is often not accurate. After many times exposure, the tissue density difference is big between neighbor images, and there are risks. For example, lesion position change during images acquisition. Although the application of the slot scanning in the current doctor device ensures the one-time imaging of the whole spine and the lower limbs, the image resolution is not ideal, although Cord S bone imaging has the strongest resolution. Due to the scanning method of its lying position, the clinical parameters of the bones obtained have a big tolerance compared with the weight-bearing position. In addition, the high radiation dose of cord also brings inconvenience to the surgery following up of patients. Similarly, in MRI scanning, it is also facing weight-bearing position measurement problems. And the imaging advantages of MRI are mainly reflected in soft tissue. There are relatively many taboos and long scanning time. Generally, MRI do not serve as the preferred solution for spine examination. Therefore, there are no diagnostic and information solutions that are currently clinically urgent needed for the three-dimensional spine scan under the standing position weight-bearing position. The China domestically pioneered dynamic three-dimensional image reconstruction system for weight-bearing positions. WR-3D, developed by Angel Technology, will change such clinical dilemmas. It can provide a very good solution for clinical spinal evaluation, whole body posture evaluation, and lower limb and hip joint evaluation based on three-dimensional scanning and three-dimensional imaging technology in a standing position. Next, let's look at the application of WR-3D in clinical spinal evaluation. We take adolescent idiopathic scoliosis as an example, which is more common in adolescents. Cup angle measurement, as the most common method for detecting scoliosis, is also the gold standard for determining the severity of scoliosis, and is an important basis for selecting surgical procedures. Although the BB method is simple and easy, there are also defects. It ignores the three-dimensional space, vertebral axis rotation, and sagittal spine balance. It cannot fully accurately evaluate the three-dimensional malformations. Patients often need multiple X-ray examinations and a high radiation dose. Traditional palate position X-ray filming is difficult to achieve three-dimensional quantitative evaluation of the spine, especially in axial rotation. Under WR-3D technology, the BB angle and vertebral rotation angle can be accurately measured. The WR-3D three-dimensional image can measure the preoperative and postoperative vertebral morphological parameters of the scoliosis patients compared with the traditional two-dimensional image measurement parameters. The vector diagram got from the WR-3D scan can display and quantify the translation and axial rotation of the vertebral body more intuitively. Postoperative evaluation is more accurate and objective. We can see that the traditional method is based on the two-dimensional plane, relying on spine or vertebral protrudes relative to the vertebral body's offset to evaluate the scoliosis. However, the WR-3D brings a more accurate 3D reconstruction of the scoliosis evaluation, which is conducive to the formulation of surgical solutions. It can also display and quantitative vertebral translation and axial rotation. The postoperative evaluation is more accurate and objective. Therefore, the comprehensive application and evaluation of WR-3D on 3D spine has very important practical value.